All right, welcome back, grade 11s, for lesson 4 on blood pressure. So in today's lesson, we're going to be learning about what cardiac output. So it is the amount of blood your heart is able to pump in a given time frame. And cardiac output is the product of both heart rate and stroke volume. We're going to be talking about blood pressure, defining blood pressure, and how physicians or anyone really is able to read blood pressure numbers and kind of determine your health from that. We're going to be talking about the factors of blood pressure. So what is going to affect blood pressure in your body? Kind of talking about your arterial resistance and your cardiac output. And then we're going to be talking about one disorder called hypertension, which is also known as high blood pressure. So cardiac output is the amount of blood that is pumped by the heart over a period of time. It determines the amount of oxygen that is able to reach your body tissues. And your cardiac output is the product of stroke volume and your heart rate. So your heart rate is measured as the number of times your heart beats per minute. And the average resting heart rate is 72 beats per minute. Maybe you can remember from phys ed class wearing heart rate monitors and kind of determining how your heart rate changes with activity. And then your stroke volume is measured as the volume of blood pumped out of the left ventricle. And your average stroke volume is 70 milliliters. If you're familiar with those probiotic yogurt drinks, they come in the smaller bottles. That's about 90 milliliters. So it's not a very large volume, but your heart pumps pretty often. So it's able to circulate blood through your body. So if you're going to calculate your cardiac output, you're going to take this average stroke volume of 70 milliliters, and you're going to multiply it by your average resting heart rate, which is 72 beats per minute. And that's going to equal roughly 5 liters of blood every minute. And contained with our bodies, we have about 5 liters of blood in total. So this amount of blood circulates through the body roughly once every minute. And these values depicted here are, of course, average. It can kind of vary per person, but it's good to have a reference point. So your cardiac output can be used to measure a person's fitness or overall health. So using heart rate monitors, they can measure your heart rate during exercise or during rest. And the maximum heart rate is the highest number of times your heart is able to beat in a minute. So that is when you are maxed out. You've been sprinting for a very long time, and you can't exercise any harder than your maximum heart rate. And it's calculated by subtracting your age from 220. So if you're 16 years of age, your maximum heart rate is going to be 204 beats per minute. So as you get older, your maximum heart rate starts to decline. But if you're looking into fitness and you want to kind of exercise strategically, we have what's called a target heart rate. So depending on your activity, you might have a target heart rate for something that's a little more vigorous. So you're going to be running a lot, playing high intensity sports. Vigorous exercise, you want to aim to go for about 80 to 90% of this maximum heart rate, because remember, this is as hard as you can go. Like, you are maxed out at your maximum heart rate. So when you're exercising, you want to aim for something that's lower than your maximum. So if you're 16 years old, to get this number, you want to multiply it by any number in the 80 to 90 interval. So 16 multiplied by 80%, or 0.8, it's going to give you about 163. And then your target heart rate for light exercise, you want to go for a little bit longer because it is light exercise, would be something in the 60 to 70% range. So fitness can be determined by how quickly your body is able to return to this resting heart rate after exercise. This recovery time decreases as a person's fitness increases. So getting your heart rate up is awesome, but if you want to kind of see how fit you are, it's how quickly your body is able to return to that average of 72 beats per minute. If your heart has a quick recovery rate, then your heart is very healthy. Your stroke volume also determines your fitness. So as a person exercises more frequently, the heart muscle grows stronger. So the strength of every ventricular contraction, or the strength of your systole phase, becomes stronger. And as well, your ventricular muscle becomes more elastic. And basically what ends up happening is you get stronger and stronger heart muscles, you get more and more in shape. With every heartbeat, more oxygen is able to reach your tissue. So your heart doesn't have to work as hard. It can kind of pump more efficiently and less often. So athletes have very high stroke volumes, and they can deliver large amounts of oxygen to the tissues with a lower heart rate. This gentleman on the right here, his name is Terry Fox. He began the Marathon of Hope 40 years today. He dipped his leg in the Atlantic Ocean in St. John's, and he ran all the way to Thunder Bay, Ontario, which is an absolutely incredible feat. But the distance he was able to run every day, Terry had a very strong heart. All right, so let's talk about blood pressure. So blood pressure is defined as this pressure up against your arteries, and it's going to be highest in the aorta. So after every contraction, blood is going to be ejected from the heart, and that volume of blood that's passing through your vessels is going to exert pressure on the walls of your arteries. So it's highest in the aorta, and as you get further and further away from the heart, it's going to decrease. So in comparison to your arteries, your blood pressure is going to be lower in your arterioles, even lower in your capillaries, because once you reach the capillary level, you kind of want things to slow down so that materials are able to pass in and out of your blood vessels into your tissues. And then when it comes to your veins, they have very low blood pressure. In some cases, your veins need the valves to kind of keep blood moving. So blood pressure pushes blood from your heart to your extremities, but then other things kind of have to take over to move it back to your heart because there's not a lot of blood pressure occurring there. Blood pressure is measured by a device called the sphygmomanometer. Try saying that 3 times fast. And it's measured in units called millimeters of mercury, or mmHg. You might remember from chemistry class if you've taken grade 11 chemistry, you might have talked about different units of pressure, the Pascal or the bar or the atmosphere, but that's just another measurement of pressure, and that's what physicians use when measuring a human's blood pressure. So your blood pressure is measured by comparing 2 numbers. It's a ratio. So your systolic blood pressure is measured during the systole phase of the cardiac cycle. It's the force of blood exerted on artery walls created when ventricles contract. So your heart is going to pump blood out, and that pressure that's exerted against the walls of the artery is going to be systolic blood pressure. Then the diastolic blood pressure, which is measured during the systole phase, is the force of blood exerted on artery walls when ventricles relax. So as the heart is filling with blood, pressure is going to be lower than when it's being forced out of the heart. I was really trying to wrap my head around this, and I thought, diastolic blood pressure has to be lower. But there's still this blood volume passing through your vessels. Your vessels don't just empty out, even though these graphics kind of say otherwise. Of course, when the valves close temporarily, but there's always this volume in here, so you're going to have a positive pressure there. Systolic blood pressure is always greater than diastolic blood pressure. Okay, so our blood pressure readings, we've got a sphygmomanometer over here, and this number on top here is your systolic. It's at 120, and here you've got your diastolic, which is at 74. I believe this number here is your pulse, so likely your beats per minute there. So your normal blood pressure readings for an infant is going to be quite low, 80 over 45 millimeters of mercury. As you get older, you're a teenager, it's going to be 110 over 70. And then adults kind of range between 120 systolic over 70 diastolic, and 120 systolic over 80 diastolic. When your blood pressure starts to exceed this normal reading here, you have what's called high blood pressure. And once your blood pressure kind of reaches this threshold of 140 over 80, or sometimes it's 140 over 90, you have a condition called hypertension. So as you start to exceed this number here, you kind of get into, go into a risk category where you kind of have to be mindful of your blood pressure. But then once you get diagnosed with this higher reading, then you might have to change your medication and consider some lifestyle changes. So your blood pressure is dependent on two factors: your arterial resistance, so it's going to be the size and elasticity of your arteries, as well as your cardiac output, so your blood volume. Your arterial resistance is going to look at the size of your arteries. So your arteries can change in diameter. With every cardiac cycle, blood is exiting the heart, going through the aorta, and your aorta is going to expand slightly just to accommodate that surge of blood. So they're going to what's called dilate. When they dilate or become bigger, the volume of your arteries is going to increase. There's going to be more area inside that vessel, and therefore pressure is going to fall. So when they constrict and they become smaller, the volume is going to decrease, and that's going to cause the pressure to rise. If you look at this cross section of an artery here, we've got that middle layer, and it's got a lot of this nice elastic tissue. So it's going to allow for a little bit of flexibility with every heartbeat. And yeah, elasticity is really important. So after every heartbeat or cardiac cycle, arteries are going to expand to accommodate increased blood flow. And then once that surge of blood passes through, so once the aorta kind of sees that initial surge of blood after systole, they're going to relax once that's passed through. And as we get older, our arteries might have increased plaque. When they harden, they're going to lose elasticity, and that's also going to increase blood pressure because they've lost that flexibility. Your cardiac output is the volume of blood contained within the arteries. It will affect blood pressure. So if someone's been severely injured and they've lost large volumes of blood, their blood pressure will decrease. And I'm trying to think if you've ever had a needle or if you've had blood taken and you kind of feel a little bit strange or woozy. I think this might have something to do with it. Increased heart rate results in increased blood pressure. So when you're exercising and you're moving about and you're keeping busy, your blood pressure is going to be a little bit higher. But when you're sleeping or you're resting, then your blood pressure will slow down significantly, like this person over here watching TV. Or your heart rate right now, unless you're kind of jogging on a treadmill or something, listening to this, your blood pressure is going to be at a nice low level. Let's talk a little more about hypertension. So it's this condition where blood pressure is higher than normal. On the previous slide, I had 140 over 80. It can be 140 over 90. Once you start to exceed 120 over 80, then you're kind of looking at that hypertension range. It's known as a silent killer because hypertension doesn't have any symptoms. So when you have high blood pressure for long periods of your life, it can lead to stroke, heart attack, heart failure, or kidney failure. Essentially, when you have high blood pressure, your heart's just working a lot harder to do its job. So you're just going to essentially wear out your muscle a little bit quicker. So what are the risks? There's a lot of risk factors that can contribute to hypertension. Age. So as you get older, 45 years or older, you kind of get this greater risk. But you can still have hypertension if you're a younger person. So it's important once you kind of reach adulthood just to get regular checks at your physicians. It's not very common in younger people, but definitely have seen these cases happen. Stress can lead to hypertension. So when your body's undergoing stress, your blood pressure is increased. So if you have a very stressful job or career, or if you're just a high stress person, it can lead to increased heart rate. Increased heart rate and blood pressure. So it's important to monitor stress and to make sure that we're being mindful or practicing mindfulness and just taking time for ourselves so that we can find ways to lessen the stress in our lives. Lack of exercise. So inactive people have higher heart rates. So your heart has to work harder to maintain acceptable levels of oxygen. So just making sure that we're exercising our heart muscle regularly so that we can kind of lower that resting heart rate and have that healthy pace there. Hypertension runs in the family. You can kind of see if grandpa has it, dad might have it. So just making sure that you know a little bit about your family history. So if you know it runs in your family, just to talk to your physician, because quite often hypertension can be treated very easily with medications, low dosages over your whole life, and you can live to be a very old person with hypertension. Obesity. So because there's more tissue that requires oxygen and nutrients in a person who is obese, the heart has to work harder to maintain acceptable levels of oxygen. So when someone was to gain a lot of weight, their heart muscle doesn't necessarily grow to accommodate that. It's the same size. So just keeping in mind, just to maintain healthy body weight to avoid hypertension. Many risk factors contribute, sorry, repeating myself here, tobacco use. So tobacco use is kind of a double whammy. When you smoke or when you chew tobacco or when you vape, tobacco use is going to increase that blood pressure temporarily. So with repeated use, you're kind of stimulating your body to increase your blood pressure. And then as well, the chemicals that are found in tobacco, they're going to damage your arteries and cause them to narrow a little bit. And when we have our arteries narrow, we're going to increase the pressure within our vessels. Prolonged alcohol use can damage your heart muscle. And this last one here, a high sodium diet. So just being mindful of your sodium intake. A lot of processed foods are high in sodium. So when you have repeated consumption of these foods, what ends up happening is your body retains all this fluid, and that's going to, as effect, increase your blood pressure. Your blood you kind of have more volume of your blood when you consume a lot of sodium. Sodium is essential for every diet. You still need to make sure you consume a little bit of sodium, but just to be mindful of processed foods. When you put salt in your French fries, don't put too much. Okay, so that is all for lesson 4. Just wanted to go over the questions and the assignment. If you were taking notes during this lesson and you wish to submit those instead, feel free. But if you want to do the assignment, you can find it on Microsoft Teams. Just click assignment and go to lesson 4. I believe I'll call it blood pressure. And there'll be a link to Microsoft Forms. We're trying to move to that so that all the assignments are kind of found in the same place and it's easy to mark and keep track of everything. Things don't get lost in email. So a couple of things you want to look at here. How is cardiac output measured? So basically, what is cardiac output? What 2 things multiplied together make cardiac output? Well, you've got your heart rate multiplied by your stroke volume. So kind of just talking about the units for heart rate, units for stroke volume, how are those things determined? Well, it's heartbeat is your beats per minute. Stroke volume is the amount of blood that's exerted from your left ventricle, not your right ventricle. We're measuring blood leaving the heart going to the rest of the body. This question 2, I believe I paraphrased it to compare and contrast systolic and diastolic blood pressure, but just kind of looking at the similarities and the differences. What's happening when you are measuring systolic blood pressure, what's occurring when you are measuring diastolic blood pressure, and then that ratio is talking about how physicians are able to interpret that. What factors of our blood pressure dependent on? So we looked at cardiac output, so the volume of blood that's in your body, as well as your heart rate. We also looked at kind of what shape are your arteries in? Are they able to expand and contract easily? Are they free of plaque? So if you have nice elastic and elastic arteries, then you're going to be able to maintain safer blood pressure. The last question is about hypertension. In the assignment, I also tacked on what is hypertension. So I just want you to tell me what that is. Give me a reading that would, qualify as hypertension. And then give me 4 risk factors that stood out to you. And just give a brief explanation of why they would contribute to high blood pressure. Not everything the notes has a blurb with it, but if you think about it, for example, stress, when your body is undergoing stress, you're going to have an increased blood pressure over time. So just kind of talking about that there. Thank you so much for logging in and listening today. As always, if you have any questions, don't feel free to reach out. I'd be happy to help you. Stay tuned for next day. We'll start talking a little more about blood.